Madhya Bahu is also very useful in giving an appropriate treatment. And then, of course, locating the Koshta Shakha Marma. And Ama is also based out of three types of ajirna: Amajirna, Vidagdha Ajirna, and Vishtabdha Ajirna. So, can you tell me which type of ajirna is more likely to cause autoimmune disease?
Vidagdha.
So most of the today's diet is also is either Vidagdha or Vishtabdha also. Viruddha Anna is also being used a lot, so they can also cause. So Vidagdha type of Ama which provokes Pitta is more likely to cause autoimmune. So this framework also make a clarification here that Ajirna and Ama are different.
Sir, you're not audible, sir. The video is stuck.
Hello, am I audible?
Now it is audible.
Okay, I'm sorry. I think this platform is a bit challenging. A lot of people are breaking, and it also happened to me. Okay, so we'll continue. So one very important aspect is that Ajirna and Ama are different. So can anybody tell me how do you distinguish between Ajirna and Ama?
Ajirna is like acute and acute like Ajirna. Ama will be like
what is Ajirna? What is Ajirna? I mean, I didn't get it. What can you repeat?
Acute like state, like Ajirna.
Okay, I would like to give another explanation. Ajirna is delayed digestion. There is a delay in the digestion, but if you leave it, it will automatically, you may just need to skip a meal and Ajirna can be solved. Or the body does a vomiting or purgation and then that Ajirna is settled. It is true, it is more like an acute condition. That's one difference. But you get a deeper understanding when we know that Ajirna is only delayed digestion. There is always a possibility for us to deal with it and it presents acutely. Whereas Ama is failed digestion. This is the big difference. Because the body has given up on Ama. Whereas in Ajirna, body is trying to do something. That is why it becomes acute. Either you burn it or you throw it out. Is that clear? So we are continuously so Ama also will not happen if you deal with your Ajirna then and there. And we fail to do that. Once, I was traveling with my one old physician guru when I was just a student, and he went out to see a lot of patients he was treating. And at lunch break, we were all hungry. So he said, let us go and have food. And in Kerala, it's very difficult to find a good vegetarian hotel always. Not when you're traveling around, mostly it is non-veg. He is a vegetarian, but since we couldn't find any hotel, we went there and we had only vegetarian food. But the vessels, everything was smelling a little bit of meat. So When we got back into the car, my guru started vomiting and he looked very miserable. So then I thought, oh, what poor man, how strong I am. I have no problem. As if catching my thoughts, he said, you have no problem. Your digestion is very weak. What we eat is not good food. So my body has recognized and is throwing it out. Your system has accepted it. Later it will affect you. So this is what is happening to most of us. We have become tolerant of many, junk foods and bad foods that our body is receiving it without, immediately dealing with it. So if you are very sensitive, it is said that yogis, when they practice yoga after a certain level, they cannot accept certain foods. Their body will not accept certain foods. Their body will reject it. So ajirna is actually a protection. If you deal with ajirna, then you can prevent ama. So different types of ajirna are there: ama ajirna, vidagdha ajirna, vishtadha ajirna, rasashesha ajirna, dinapaki ajirna, prakrita ajirna. That is, when you eat food, it takes about 3 hours for it to get digested. Till that time, we call it as ajirna. But ama is different. So I'm just providing this ama classification chart here, with which this is very useful for me clinically. In any patient, if it is alpa ama, I decide to go on a lankhana mode. If it is madhyama ama, it will be lankhana pachana. And if it's only bahudoshasya lingani tasmai samshodhanam hitam. So if you need to do panchakarma or any shodhana, the criteria is that it should be bahudosha. Second criteria, whether you should do snehasveda purvaka panchakarma shodhana or sadhya shodhana. If it is chala dosha, you can do sadhya shodhana. If it is leena, alina, achala dosha, you can do sneha sweda and then do the shodhana. But if it is leena or alina, I have to first give deepana bhajana for a few days, then do sneha sweda, and then only I can do shodhana. So this is a very useful tool in my clinical experience to decide what type of treatment we should give in any particular patient. And then the second thing is the next important thing, which clinically, irrespective of what is the disease, we don't need to worry about the disease. How is the doshas moving? Is it moving from koshta to shakha predominantly, or from shakha back to the koshta? In all diseases, bringing everything back to koshta is very, very critical. So if these three controls you have in your mind, I think almost all diseases, even without names, we will be able to deal with in a more efficient way. Many times I find we don't know when to do. Dr. Prasad, your mic is on and we are hearing some background noises. Dr. Prasad Pankar, your mic is on. Some background noises are coming. Okay, so I hope you got this idea of what do you think about this chart? Do you think it will be clinically useful?
Yes, sir.
So it's also easy because ama is difficult sometimes to find. I am using this framework to decide what type of ama it is. If it is acute, I call it as chala. If it is chronic, I consider it as achala. If the disease is episodal, I consider it as leena. And if it is silent, of course, it's difficult to know. If at all I find that there are some indicators, then it is leena dosha. Most of the time we know leena dosha only after some untoward event has happened. So this I have found to be extremely useful. Like for example, if you take multiple sclerosis, you have primary progressive, you have relapsing remitting, you have secondary progressive, all these presentations are there. Based on this classification, let me ask you a question. Where would you put primary progressive multiple sclerosis? Would it be acute, chronic? I mean, would it come as chala dosha, achala dosha, or leena or leena? Multiple sclerosis. We know it's also an autoimmune disease.
Leena.
Where would you place?
Leena.
No, actually, relapsing remitting is lena, whereas primary progressive is like more of chala dosha. Very quickly the patient, I have been treating many multiple sclerosis cases. Some of them which are primary progressive actually go very quickly, they progress. The disease is very active, whereas some people have achala, alina achala dosha, because they are able to maintain, their progression is not so fast, that we can consider. So what I have found is, instead of giving the same treatment to the multiple sclerosis patients, if you can classify them, so relapsing remitting requires another treatment because dosha is lina. That which is not progressing so fast, that is, we can consider as alina achala, and then that requires another way of management. And then that which is progressing very fast and suddenly causing disability and problems, that we can consider as challenge. So this is actually very helpful. So with this part, now I want to quickly go through modern concepts, and then we can draw some conclusions. In this short time, there is a limitation to the extent to which we can discuss. I wanted to try and make this interactive so that I can also hear your views. It's like just clinicians sharing their experiences, and I can tell you whatever I've told so far as are conclusions that I've drawn, not just theoretically, but actually from my practice and some of the research studies that I have been involved with. So autoimmune diseases, according to modern medicine, happens when the body's natural defense system cannot distinguish between body cells and foreign entities. So in this definition, I'm looking at body cells. We can consider that as representing dhatu, and the foreign entities as ama. So the body attacks normal cells mistakenly. This is a modern definition. So I hope this idea that lina dosha in the dhatu, provoking pitta's fury, the anger of pitta to destroy that ama, but in the process the cells also getting damaged. This is the whole process of autoimmune diseases. And 80 types of autoimmune disease affect a wide range of body parts. So this process can happen either in koshta, in shakha, or in marma, in any of these places. So that's the concept. And these are so many diseases. You can see, I'm just mentioning this because the extent from koshta, you can see, to the shakha, including the shirohridayavastya, the Rumani Astram Sandhya, Asti Sandhis. So from koshta to so we cannot say that autoimmune diseases affects only the koshta, or only the shakha, or only the marma. It can present in any of these regions of the body, but always leenatva of the ama, involvement of pitta, and the destruction of the dhatu by the dosha itself. These are the hallmarks of all autoimmune diseases from an Ayurvedic perspective. So we see some of the symptoms, like, commonly what we see is fatigue, joint pain and swelling, skin problems, abdominal pain or digestive issues, recurring fever, swollen glands. And in all this, you can see inflammatory processes, which is why we can give pitta some importance here. Pitta and rakta should be definitely dealt with. And that is what makes autoimmune disease challenging. Ama is more related to kapha, whereas that process of autoimmunity brings in pitta also. So we have to do treatment that is, balancing both. And another problem with autoimmune disease, that also I want you to understand, because most autoimmune diseases present with pain. So how do we understand this from the Ayurvedic perspective? Although Vata doesn't seem to be so directly involved in this process, does pain also signify a very, clear involvement of Vata? Any suggestions? available.
Sometimes pain is due to pitta also, no? Like vata is main, but like pitta should is also there.
Yeah, my understanding has been that there is some kind of avarana of vata also occurring in autoimmune diseases, making it a little bit complicated. I don't know what is your opinion, but this is also a big challenge in autoimmune diseases. Modern medicine is failing in the management of pain. And this is where I feel acute pain they're able to manage to some extent, but it becomes very chronic. One of the major problems in autoimmune diseases is that pain tends to become chronic, right? Even in multiple sclerosis, initially there is no pain, but after a while, we had a patient whom I had treated recently. After a few years, we were able to slow down the progression and stabilize because this is a progressive type. And improve quality of life. Those things we were able to achieve. At one stage, we found that the patient is complaining of a lot of pain. So this keeps happening in many autoimmune diseases. And modern medicines are quite good in relieving pain short term. And I think the key to Ayurveda is to understand the avarana of vata. In the long term, we have to treat avarana of vata. In my opinion, that is why in diseases like rheumatoid arthritis, we either call it as ama vata or vata rakta. So there is that background vata involvement also. Although it is created predominantly, the cause is kapha in the form of ama, and the trigger is pitta in the form of that inflammatory response. And then this causes a triggering and avarana or rodha of vata also. So this is a very key concept here that I'm making a statement that autoimmune diseases are challenging and difficult because of the trudoshic nature. What is your opinion? What do you think? See, I'm speaking just like... Yeah.
No, sir, yes, sir. Those factor is there only. Hence, it becomes like when treatment also we have to be very careful.
Very careful. So we have to treatment that is not virodha of any of these three doshas. That is what I think makes autoimmune disease really very challenging. When I'm treating ama, I should be pitta viruddha. And this whole treatment of kapha and pitta should not be vata viruddha also. Only then I can treat autoimmune diseases successfully. So that is the formula, what I have understood. So autoimmune diseases and chronic inflammation, that is a problem. This chronicity of the inflammation causing this. So acute inflammation is natural. And the problem with autoimmune disease, according to modern medicine, is that this inflammation lasts much longer. And most of the time it's the joints in the hands or knees. And this is very interesting because the joints is the place of kapha and vata. So coming into the location of kapha vata location, this probably seems to be the reason why, because the location is that of both vata and kapha, and pitta comes there and causes this disruption, like coming in between vata and kapha. That's how most autoimmune diseases, the joints in the hands or knees are affected. And the pain becomes chronic because it is not an acute thing. You kill the bacteria or the offending invader and the inflammation subsides. But here it becomes continuous. So in many diseases, the pain can manifest, inflammation can manifest differently. So this is something which I think Ayurvedic view gives us new perspectives in approaching this. Multiple joints affected. Pain is the worst when on waking up or in the morning, morning stiffness happens. It's also the time it indicates, that is, I think, a very key thing to say that it is due to avarana. The reason why I think avarana, because if it was purely Vatic type of pain, it would have been more in the evening, right? So morning stiffness is in the Kapha Kala. And in the Kapha Kala, ama can become aggravated and Vata becomes blocked. Either it's Rodha or Avarana of Vata. That is what is causing the morning stiffness. And that is stiffness. So, it's absolutely due to blocking. What do you think about this logic? This is something which I learned by seeing a lot of rheumatoid arthritis patients. Probably why they are getting morning stiffness. I thought a lot about it. And it is not just ama, because kapha is there, inflammation is there, and then vata is also coming in. So without these doshas doing an avarana of vata, we wouldn't have had that situation. This is the reason clue I got that we must treat vata eventually in all rheumatoid arthritis. Avarana chikitsa at the end is very, very helpful. In all autoimmune diseases, after a stage, you must start, because the disease also in the beginning stages, early stages of the disease means I will attack kapha more. If it is in the middle stage of progression, I am working more on pitta. If the disease has progressed a lot, they are coming in a very late stage, then I am giving more importance to vata. This is something I'd like to share with you and get your opinion. What do you think about this approach?
Yeah, sir. Treating in the early stage is quite easy. Like kapha chikitsa is quite easy, but vata it becomes like
yes.
Yeah.
So what I do in my patients is I classify them according to also the chronicity of the disease, and then decide which dosha I must give more importance to. So when a patient comes with a lot of progressed disease, if I say, okay, this is caused by ama, so let me do very strong ama pachana. No, I do pachana also there, but the focus is more on stabilizing vata. So this I found clinically getting better results from the patients. So lupus patients have also fibromyalgia. Mamsa dhatu is also affected. In ankylosing spondylitis, there are slight differences. Especially the axial skeleton is more involved. So these things also give us clues on the sthana of the disease. So we know that today we have a few options. First, they try NSAIDs. I'm not talking much about this. I want to show what is our strength in autoimmune disease. Then they give steroids, then DMARDs, then non-biologics, and then biologics. So these are the 5 options that they have to treat, these diseases, not only pain, but also the inflammation. And all of them have problems. So this is where the long-term approach. So the challenge with autoimmune disease is long-term inflammation. And all currently available pharmacological interventions work in the short term, and they can cause serious side effects in the long run. So this is the real treatment gap that we have. And since the inflammation does not go away, that is why chronic pain comes in. And already sorry, just a second. So, already in modern medicine, as I said, they have found that exercise and diet. I think this is because healthy lifestyle, balancing the Shakha Koshta Gati and Koshta Shakha Gati is so critical in autoimmune disease. And in modern medicine, they have found that exercise helps to reduce pain, improve strength, reduces fatigue. Overall disease activity is reduced in diseases like ankylosing spondylitis. A lot of feel-good chemicals, endorphins come. Ayurveda advises moderate exercise and careful choice of articles. So pro-inflammatory diet articles can be avoided, and this is actually very, very good. So yoga, moderate exercise like walking, swimming, engaging in sports to the extent possible are all helpful in autoimmune diseases for this reason. In Vata Rakta, there is a saying like if circulation is hampered, vakratvad avatishtate, that stagnant circulation, micro circulation especially, we need to activate. But what is not very clearly known in modern medicine is about anti-inflammatory diet. I think this is an area where Ayurveda can really help, because we have this concept of Kapha, Pitta, Ama and Vata, and so Generally, we can say red meat, caffeine, alcohol, fried foods, these are already advised to avoid because they can increase inflammation. A pitta pacifying diet, cooling, slightly dry, low salt food. We can understand what is currently advised in terms of Ayurvedic, concepts, but there is a lot of scope. It's beyond the scope. We are already coming to the end of our session, so I'm not going too much into the diet, but adding, I think, many herbs like ginger. Can you tell me the difference between ginger and pepper? I would not recommend pepper in autoimmune disease, but ginger could be carefully used, in my opinion. Why do you think so? Do you think there's any rationale behind that?
Maricha leads to Utklesha.
Yeah, it is Pramathi.
Yeah, Maricha is Pramathi, that is fine, but that could have been actually helpful here. The problem is Maricha is very pitta provoking. Pramathi quality is actually helpful here because Leena dosha can be removed by, Leena dosha can actually be removed.
There is more
By-
Patura
but
Sarva,
it's-
more Ushna.
It helps
Very
only in
Ushna.
Tamakashwasa, not other diseases.
Not all diseases. No, because in Tamakashwasa, although Pitta is involved, the sthana in the Pittashaya Samudbhavam it is mentioned, there is Pitta involvement also, but basically to remove the Leena Kapha, it is very helpful. And also in Jwara, today we are taking this pepper soup and all that in fever, but from Ayurvedic point of view, in Kerala we use what is called as rasam. It is a type of preparation where they add pepper. I've always noticed this Ayurvedic texts. In Jwara Chikitsa, pepper is not at all mentioned, whereas ginger is mentioned. Because the reason why ginger is acceptable is because it is in Vipaka, it is Mathura. It is Vrishya also. So, but that doesn't mean in the Koshta, as long as it is not digested, it can provoke some pitta. So people with lot of acidity in the stomach, it may not be helpful. But at the dhatu level, it will not aggravate pitta much like, pepper. So in this way, if we very, very carefully look, because we need something which will digest ama, at the same time will not provoke pitta more. So ginger I would give in a very early stage of autoimmune disease, not when pitta and vata are more aggravated. At a later stage, I may be very careful with ginger. So this kind of discrimination is what I think is very critical in the management of autoimmune disease. And I'm giving just some feelers in this talk. It's more like an introduction and mutual discussion, sharing my experiences. So in Ayurveda, long term, I think the two things that we are doing in autoimmune disease that really makes the difference is dealing with ama. Being very sensitive about the doshas that are involved, understanding, and this is what makes, because in modern medicine, there is no long-term treatment for autoimmune disease. There is nothing to reverse it. They are only suppressing the immune system, suppressing inflammation, and then people have to live with the disease or the side effects of the disease. I think in Ayurveda we can hit the target because we understand the source of this problem. That concept is not there. They don't know why autoimmunity is happening in the first place, whereas we know that it is due to Leena ama and that pitta is involved, and that by doing this without suppressing the immune system, we can specify it. Kripabhyasa iva krodha. So when you say kripabhyasa iva krodha, it means it takes some time. So what I have found is that if people, you have to also be practical. In my practice, in acute phases, if they need some modern medications, I am not so adamant and not allowing them to do that. But my goal is slowly wean them off that and then bring them to Ayurveda. And that weaning off period is the most challenging. You may get into conflict with allopathic doctors, some patients. But once they come out of that and they are able to wean them into pure Ayurvedic treatment, then they make very good progression. So I don't know what is your experience. These acute flare-ups and sudden presentations are where, as an Ayurvedic physician, I face some limitations and challenges. So at this point of time, okay, for a short term, if they do allopathy, it's okay, is my approach. I try to do with what is available. I'm also open to suggestions on, what could be alternatives in rheumatoid arthritis. I feel more bold use of medicines like bhalataka. We have to be very careful because it has to be used as a rasayan. It's very ushna, but it helps. Karaskara is Shita Virya. It's very helpful. Some Ushna Virya Dravyas are helpful in these conditions, provided you use it. You need to know to target the ama, you can use it, but without provoking pitta. So like Bhaladaka Kshira, or we have to do the Kalpana very, very carefully. So this is my understanding. So immune dysregulation can also be, revised. So this is the overall understanding what I wanted to share with all of you today, and it's almost time. I'd like to can take a few questions, so the topic today was Ayurvedic approach to autoimmunity, and I shared whatever I know from my clinical practice. Details of the treatment for specific diseases is beyond the scope of our discussion, so I'm not initiating it. Maybe in a future we could mutually share our experiences and specific formulations and strategies. But now let me conclude here, and I'd like to hear from you, and then we can close the session. Thank you.
Sir, can you share your thoughts regarding castor oil? Like Arundel is used many a times in arthritis. So how you find it safe a drug? Like, is it it can use it like in all types of patients, or there are limitations on that?
I use usually in autoimmune disease, if I need Arunda Thailam, I use only Nimbamritadi Arunda Thailam. I don't use pure Arunda, or I don't use Gandharvastadi Arunda. I use only Nimbamritadi because, as I told you, we have to see both Kapha and Pitta. And this is when you use Nimbamritadi Arunda Thaila in many conditions. And I use it more when I have to target Vata, without disturbing Kapha and Pitta. So the Nimbamritadi, which is from Gugula Tiktagam, the Panja Tiktagas, will take care of Pitta and Kapha. Is that clear?
Yeah.
So I think in those conditions we can. So I am looking at this whole spectrum as Kapha, Pitta and Vata. So if you are more towards the Vata spectrum, then you can use Nimbamritadi Arunda Thailam, but I don't use pure Arunda Thailam because that cannot balance the doshas. Nimbamritadi Arundam, when you want to target Vata without disturbing Pitta and Kapha, I think it's a good choice. I've used it. In many rheumatoid arthritis patients, I've used it.
Okay. Yeah, thank you, sir. That was very well explained.
At this stage,
Sir, mine is very.
I'm not able to hear.
at which stage?
Your voice broke again. Can you repeat? Sorry, Pradeep.
At which stage Musta is to be used?
Yeah, Musta, what I have found is basically for Pachana, especially if there is Leena dosha, very Leena, and either if you are able to judge it in the beginning, I give in the beginning itself, like Shadharanam and those things can also be used as an alternative. It is there in Shadanga also. But sometimes what I understand is when I think Pachana has been done with other dravyas, but after the treatment, when I go to Shamana, again the recurrence is happening. That is when you also know that the dosha is more leaner than what I expected. Because only from clinical response we will know that, right? We cannot be fully theoretically, we cannot understand. So in such patients also, again I introduce Pachana. If I think my previous judgment was wrong, okay, there is more Leena dosha, so now we have to do the Pachana and bring it out. And another thing is in diseases which affect the Koshta, Musta is even more effective.
Yes, sir. Thank you.
Yeah.
Sir, mine is a very basic question. So can you guide me from where we can understand how the doshas are lean clinically? When the patient comes, that I could understand he's in a phase of autoimmune disease. and the doshas are in a leaner stage, that he may land up into positive reports after some time
Yes.
for autoimmune.
I mean, I didn't clearly understand your question. Can you repeat what exactly?
Can you,
was-
okay. Just can you tell how I can differentiate that the AMA is in leaner stage when the patient comes, that we can understand.
Yeah. So the thing is, when the autoimmune disease in the original condition, when it is Lina Avastha, we will not know anything, because this is the biggest diagnostic challenge in Ayurveda. What acharyas have said is Linatvad Jadya Vaivarnya Karshadin Adadadisa. They have given some clues. Aprasannendriyam Viksha Purusham Kushalo Bhishak. So, Linatvad Karshyam, some effect in the weight balance. Vaivarnya, there's some effect in complexion. Jadya, a certain kind of fatigue. They're not working to their full potential. So these kind of symptoms are mentioned in the texts. Probably we should devise some wellness scale which will, indicate because many of this time when the Lina dosha is there, metabolic abnormalities may not have started manifesting at all. You have heard of obesity, right? Metabolically normal obese people and metabolically abnormal obese people. So many people, when they're obese, they go and do their blood test and it's all normal. So they say there is no problem. But according to Ayurveda, there is still a problem. So I feel that some wellness criteria we'll have to look at. And if you suspect that, then we have to consider that he is in a Lina Ama stage. And the Purna Swasthya Lakshanas will not be seen when you are having Lina Ama. That is what Ayurveda says. So you may not have a disease as yet. So that is something which is challenging. Right now, I am only looking at some subjective parameters and I tell them, why don't you do a course of treatment? That is what we say, Nabhasya Prathame Masi, that Rutu Shodhana is mentioned. All that is based on the same principle of identifying Lina Dosha and treating it. But the another thing is, when autoimmune disease manifests and when you start treating it, then only you realize how much Linatum the dosha is. That depends on how the patient responds to your treatment. If I do a Shodhana and the patient gets really better, excuse me, just a moment, this is an official call.
Hello. I think sir's voice is not audible or some.
No, sir had a call, so he has taken a break. He's coming back.
What?
There was a call, urgent call, sir had to take in, so he has taken this short break. He's coming back to us. The question and answers are going on.
So I'm sorry, there was a call from the ministry. That is why I had to attend it. So I'm back. I request.
No problem.
Requested them that the further discussion we'll do a little later, because sometimes it's very urgent. We are doing some projects. Are you able to hear me now?
Yes, sir.
Okay. Yeah, so there was a question, or I think I just broke off at that point. Can you please repeat it? We can come back to that.
How to identify the lean avastha?
Yeah, how to identify. So, yeah, sometimes what happens is in some autoimmune diseases, when you do good shodhana and you treat itself, the patient gets really better. After that, there is not much recurrence. Then we understand that we don't have to do any further pachana. But sometimes, it keeps recurring. That is when we understand that the lead. So once the disease manifests, to know whether there is residual lena ama is not so difficult to understand, because, the disease will again repeat. After some time, there will be another episode. So usually in diseases like rheumatoid arthritis, we tell 3 years is my experience to really bring it into control. We may have to repeat again a treatment till the residual lena ama is completely removed. And then we may have to continue some pachana also. Dosha sheshasya pakam. This is a very important concept. Dosha shesha will be there, some residual remaining thing. So lena ama in these two ways. One is before the disease manifests, if you can catch the lena ama, that is the best way. You can prevent a lot of autoimmune disease. So I think just a preventive measure. There is no harm in doing a pachana shodhana treatment periodically. I think if we do that on a large scale as a public health intervention, we could prevent the incidence, the higher incidence of many diseases, all the non-communicable diseases like diabetes, heart disease, cancer, and respiratory diseases. This is my strong feeling. Yeah, HCC, once the cancer becomes active, then, it is chala dosha. And HCC is very difficult to treat. We are trying to work on it. It has a very rapid course. And there are some of my colleagues who have found good results in HCC. That is with Patula Kadurohinyadi Kashayam. Then, Shiva Gutika, then Arogya Vardhini. With these medications, I have seen a patient of HCC, recovering remarkably. I mean, he was bedridden, but I don't know, it was treated by one of my colleagues, so I don't know how long he survived, but definitely the AFP values and all drastically reduced. So some of those treatments could be tried. In HCC, that is what we treating the liver, but when it has metastasized a lot, then it is a bit of a challenge. Dvirarbudam, according to Sushruta, is asadhya. We may have to try some RESA treatments. There was an allopathic doctor here in Kottayam who was an allopathic oncologist, and he was using RESA medications. And he uses herbs like Navapashanam, Rasa Sinduram, then there is Nandi Malga, Rasagandhi Malga. These are all Siddha Ayurveda formulations. With that, he says, in metastatized condition also, he was able to get results. Because when he was an oncologist at Kottayam Medical College, one of his patients, whom he expected to die in 2 weeks, went to a Siddha doctor, got the treatment of Rasa medicines, and he lived for 8 years. So that's how he changed himself. He embraced Ayurveda and yoga. And the first medical oncologist of Kerala, he just passed away, I think just 1.5 years ago. And in JAME, we have written one article recently about his life and his contribution. So what I found is that in metastatic disease, using Rasa medicines very carefully will be helpful. But in the background, doing that deep pachana, because cancer has emerged out of a Lena dosha background. That will be very helpful in liver cirrhosis, in HCC in early stages like Padula Kaduruhanyadi. This medicine has a very good scraping, Lena Ama removal from liver. Padula Kaduruhanyadi is very helpful. For Shamana Vasa Guduchadi is very helpful. So Padula Kaduruhanyadi, I know I've seen people using it in HCC with some success, but it all depends on the stage, various other comorbidities. Generally, HCC is a bit tough to handle. So I hope that was helpful. I'm sorry I don't have, yeah.
So when the drug is not that Balwan, like we use Vasa Gudachari. And if it's like Balwan, so no.
Yeah, Vasa Gudachari is more like a little bit more Shamana. You know, in early stages of cirrhosis, it's helpful. But when the doshas become more leana, and then it proceeds more in advanced stages, and Padula Kadurahanyadi is more helpful in my experience. And Drakshadi is also helpful for liver. There was one student of Amrita Ayurveda, School of Ayurveda. She had liver cirrhosis and was advised liver transplant, but our former principal Vasudevan Nambudiri sir is very famous in Kerala. He treated her, and with one of the medicines that was given was the Rakshadi Kashayam, and Dashamula Haritaki is also very helpful. And she could prevent liver transplant. And she, at the age of 14, she survived, didn't need a liver transplant, so she dedicated her life for Ayurveda. She came and joined here. And just a few years ago, she graduated. So I saw this living example in front of me. So Drakshadi is helpful when you want to do Pitta Shamana, because liver is the sthana of Rakta and Pitta. So for Rakta Pitta Prasadana in the liver, the Drakshadi is very helpful.